Morning and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today again is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. We're back again with encouraging news. Our local situation continues to improve. On Friday, I shared with you that based on our community's progress, we were able to remove the directed health measure early. Through the weekend and so far this week, the progress has continued. The number of new cases, our weekly cases, is down 47% from the previous week, and hospitalizations have dropped to about 60 patients a day. So let's take a look at our data now. The chart you're seeing shows the continued drop in new cases per week. You can see that we've now had 5 consecutive weeks of decline, from a high of nearly 5,000 cases per week down to 432 last week, ending on Saturday, February 19. Also encouraging is that our positivity rate has dropped significantly over the past few weeks as well, from a high of 30.7% the week ending January 22nd to 8.1% this past week. Last week was a turning point for our local hospitals. It has been a relief to see COVID hospitalizations decrease so significantly. This chart shows the decline of the 7-day rolling average of COVID-19 patients hospitalized from 141 at the beginning of the month down to an average of 61. Today, the hospitals are reporting 60 patients, with 42 from Lancaster County. And sadly, we're reporting 1 death so far today, a man in his 40s. We've lost a total of 28 members of our community to COVID so far in February. Now, turning to our Wriststyle update. With improvement in our local indicators, the Wriststyle has moved from elevated orange to low orange this week. Our Wriststyle has not been in low orange since the week of November 9th. The orange level indicates that the risk of the virus spreading is still high, but we continue to see improvement in the indicators. With the Wriststyle in orange, we continue to recommend that people wear a mask indoors. You can find the latest public health guidance at covid19.lincoln.ne.gov. Our community is coming through this surge, and COVID is loosening its grip. Vaccinations will continue to play a key role moving forward. It remains our most powerful tool in preventing severe illness and saving lives. Getting the COVID-19 vaccine and booster gives you the benefit of the best protection. The health department strongly recommends that everyone who's eligible to get vaccinated and get a booster dose do so. We're working with community partners and hosting several convenient walk-in vaccination clinics this week. This afternoon we'll be at Hartley Elementary School from 4 to 6:30. Tomorrow we're hosting a clinic at Everett Elementary School from 3:15 to 6. And we'll have a clinic at the health department on Friday from 9 to 3. All the clinics offer first and second doses and boosters. More clinic times and locations are available on our website or by calling us at 402-441-4200. Currently, more than 66% of all Lancaster County residents are fully vaccinated. And about 60% of residents 12 and up have received a booster or third dose. An important vaccination reminder: if you have a weakened immune system and received a third dose of COVID-19 vaccine, a booster dose is recommended at least 3 months after the third dose. If you're not sure if you're due for a booster, contact your physician or call the health department at 402-441-4200. I have more information to share today about the at-home testing initiative of the Nebraska Department of Health and Human Services. We have received our allotment of at-home test kits. They will be available to the general public at the health department at 3131 O Street in the main lobby during regular business hours starting today. A limited number of kits will be available on a daily basis. Additional test kits are allocated to schools, child care centers, cultural centers, and other sites to enhance access to testing. The health department is now contacting these entities, and we will begin distribution to them. There are several testing options in the community, and you can find them on the COVID website. In closing, we're on the right track, and we continue to see significant improvement in our local situation. The pandemic is not over, but each week we're making progress and getting our community to a better place. I want to say thanks again to each of you who have helped move our community forward. And with that, we'll be happy to take any questions.
Star.
Good morning, Matt.
The test kits that you're making available at the health department, approximately, can you tell me approximately how many there are that are available to the public?
Well, we're putting out so many every day, and we're just seeing what the response is, and we'll keep allocating more. They come in allocations of 6, so we're recommending that people take 6 to begin with, and it's on the honor system. And if they need more than that, we're happy to help them make sure that they get what they need. And we're thinking with the wide distribution at the schools and the child cares and our cultural centers, that's going to help a lot of members of our public access the test kits. However, we don't want the general public going to the schools or the child cares. But we do want to make sure we have plenty. So there shouldn't be a problem for anybody that comes in, Matt, if that's what you're asking. We'll make sure we take care of them.
Okay. And then I just had one more question about the death numbers, which continue to remain really high. But would you expect, since that's sort of a lagging indicator, that those numbers would begin to start going down soon based on the case numbers and the hospitalizations and the big drops there?
Yes, and that's a great question. I appreciate you asking it. We do anticipate that we'll start seeing an improvement in that area soon. Probably it may be another week or two before we really see the full lessening of the impact of Omicron and Delta, but we definitely anticipate that's what's going to happen.
Okay, thank you.
Okay. With that, thanks again for joining us today, and remember to get vaccinated and get your booster and wear a mask.